Hello, I'm Dr. Brad Holmberg, co-founder of InvisalignDoctors.com. This tutorial is an abbreviated version of IPR with Invisalign Treatment. The full version can be viewed on our learning website, www.InvisalignDoctors.com. IPR is often needed in orthodontic treatment. Its purpose is to create arch space. The technician will often add IPR for your cases, but I prefer to use the 3D controls to add it myself. So it's a good practice to ask yourself these questions. Is IPR needed? Is the IPR timed correctly? And is the IPR in the right location? In the next series of slides, I will discuss indications for adding IPR to Invisalign treatment plans. To create space for alignment, in this case, lower anterior alignment is needed. IPR can be added to create arch space to align these teeth. Teeth are moved forward in alignment unless there's space available. It's important to make sure teeth are not moved too far forward, especially in cases where there are periodontal concerns. If they are moved too far forward, IPR will be needed. The superimposition tool is helpful in visualizing the forward movement of these teeth. IPR can be used to improve a Class 2 or Class 3 cuspid relationship. In this case, IPR was added distal to the upper cuspid tooth. The IPR allowed for distalization of tooth 11, which improved that relationship. Black triangles can appear later in treatment after alignment has occurred. The IPR will reduce the interproximal taper of teeth, which will reduce the black triangles. IPR may be needed to manage overjet. Here's an adult Class 3 case. Now this is the first ClinCheck that came back, and I don't allow IPR for the first ClinCheck, so upper arch space was added to finish with positive overjet. In order to close that spacing, you would have to add lower IPR. Access to interproximal contacts is necessary to perform the IPR. This means some alignment needs to occur before the IPR is timed. In this case, the IPR was timed at stage 27 after alignment. Note that the IPR flakes turn yellow at the stage when the IPR is to be performed. Let me show you how to add IPR using the 3D controls. This is a Class 2 case. There's a lot of overjet. And I'm going to add posterior IPR in 0.5 millimeter increments to reduce that overjet and improve the cuspid relationship. So you just click on this little green plus sign. If you want to remove it, by the way, you would just click on the red X. A little flag appears, and you can go ahead and increase or decrease the amount. Let me add it a couple sites distal to the cuspid teeth on both sides. So you can see the real-time effect of the reduction of that overjet by adding the IPR using the 3D controls. The little paddle lock means that you can kind of left click this, and you can either lock or unlock the IPR. When you unlock it, that means the algorithms can change the amount. If you lock it by just clicking on that paddle lock, then it will not change as you make other changes. So that's adding IPR. And by the way, you could also add spacing. Sometimes in a Class 2 case, I'll just add a little spacing distal to the cuspid teeth. So you just select Add Spacing, and it's the same kind of thing. You go ahead and you can adjust the amount. You can lock or unlock it, and you get to see the real-time effect of adding that spacing. Cuspid relationship is improving, and that overjet is decreasing. Thank you for viewing this tutorial. Consider joining our community of Invisalign doctors on InvisalignDoctors.com. This tutorial and many more can be viewed in their entirety. Personalized case assistance is also available on our site.